Okay, so welcome to Eat, Move, Think, the show about optimal wellness brought to you by Medcan.
Wow. Do it again.
Oh, I was practicing.
Okay, ready?
Welcome
to Eat, Move, Think,
the show about
optimal
wellness brought to you by
Medcan.
Yeah, this is extremely good. Thank you.
Every so often, we get an email from Eat, Move, Think host and Medcan CEO Sean Francis suggesting that we look into something.
And we do our best to snag it.
Yeah, absolutely. And that's what happened with this episode. He sent us a study about controlled breath work.
Yeah, sounds really cool. And it turns out this study was by two pretty big, I want to say, celebrity researchers.
The lead authors were Dr. Andrew Huberman of Stanford University and of the famous podcast, which we
love him.
Yeah, we love that podcast.
Yeah.
And Dr. David Spiegel.
Dr. David Spiegel is also at Stanford, and he is a legend in the world of behavioral science, integrative medicine. He is a world-renowned expert in hypnosis.
He's the director of the Center on Stress and Health and the medical director of the Center for Integrative Medicine at Stanford University School of Medicine, where he's been a member of the academic faculty since 1975.
It's nerve-wracking as a chase producer when someone wants you to get heavy hitters like these. I wasn't sure it was going to work out.
So you craft the email, though, all the same, because why not?
I sent an email. I sent another email.
And what was the response?
Dr. David Spiegel was in for the interview.
I'm Chris.
I'm Jazz. We're the producers of Eat, Move, Think.
And in this episode, we're featuring an interview between Dr. Amanda Beaman.
She's Medcan's consulting psychologist, and she's interviewing Dr. David Spiegel,
the lead co-author of this study on controlled breathing, which Dr. Beaman and Dr. Spiegel will get into in the episode. But basically, it's a way to use your breathing to improve your mental affect, to become more happy, less depressed, less anxious.
Yeah.
Purely by virtue of how you are breathing.
Right. It's a tool to help manage anxiety on an ongoing basis.
I'm really excited about exploring this.
Here's Dr. Amanda Beaman in conversation with Dr. David Spiegel.
Well, hello, Dr. Spiegel.
Hello, Amanda.
What brought you to studying the connection between our breath and bodies? It sounds like you've been doing this research for quite a while.
I have.
So I was just wondering if you could tell our listeners a little bit more about your background and where did your interest in breath work come from?
Sure, Amanda. I've always been interested in mind-body relationships. I was an existential philosophy major in college, and I love thinking about how we think. And then when I got to medical school, I got really interested in the body and how the brain influences the body. But I'd say my interest in the breath, the mind, and the body happened in 1970 when I was a medical student on pediatrics. And the nurse told me, Spiegel, your next patient is in room 341. She's in status asthmaticus. And I could follow the sound of the wheezing down the hall. I walk in the room. There's this pretty 15-year-old bolt upright in bed, knuckles white, struggling for breath, audibly wheezing. She had been unresponsive to subcutaneous epinephrine ×2. So the next step was going to be general anesthesia and then putting her on steroids. And her mother was standing there in the room crying. And I had just taken a hypnosis course. So I thought, I don't know what else to do. So I said, would you like to try a breathing exercise? And she nodded. So I got her hypnotized. And then I broke out in a sweat when I realized that we hadn't gotten to asthma in the course yet. So I came up with a very clever suggestion. I said, each breath you take will be a little deeper and a little easier. And within 15 minutes, she's lying back in bed. She's not wheezing anymore. Her mother stopped crying. The nurse ran out of the room. And my intern comes looking for me. And I figure he's going to pat me on the back and say, what did you do, Spiegel? He said, the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent. Now, Massachusetts, I lived there for 7 years. It has a lot of strange laws. That is not one of them. And her mother was standing next to me when I did it. So then the intern says, you've got to stop doing this. And I said, why? Well, it could be dangerous. I said, you're going to give her general anesthesia and put her on steroids, and you think my talking to her is dangerous? I'm not, take me off the case if you want, but as long as she's my patient, I'm not going to tell her something I know isn't true. And they came back on Monday with a radical idea at Children's Hospital. They said, let's ask the patient. And she said, oh, I like this. Now, this young woman had been hospitalized every month for 3 months.
Wow.
I thought that anything that could help a patient that much, that fast, without doing any harm, frustrate the head nurse and violate a non-existent law had to be worth looking into. So it was one of those moments when I just thought, all of my classmates have just read the New England Journal that morning and come up with some new drug to treat something. But not many of them have paid much attention to just what the brain can do to control the body. And so I've spent most of my career doing that. So with hypnosis, with breath work, our major evolutionary advantage, Amanda, is this 3-pound organ on the top of our bodies. Among the animal kingdom, we don't run very fast. We're not very strong. We're not very big. We don't smell that well. We don't see that well. We don't hear that well. But we think and feel and form relationships and plan. And that is our major evolutionary advantage. But it didn't come with a user's manual. We don't really make the best use of our brains. So it occurred to me that it would be worth learning about and helping people with ways of using their brains to better control their body. And I'm a physician. I prescribe meds like a lot of other physicians, but it's not the only thing I do. And so I, in 1998, started a Center for Integrative Medicine at Stanford. And we are helping a lot of people in a way that's a little bit different from the mainstream, but you can do a lot with your brain.
What a wonderful story. And it really just sets the stage for the rest of our discussion today.
Sure.
Thank you.
You're welcome.
I mean, we've in the past year talked a lot about the increasing prevalence of anxiety and depression and other mental health issues on this podcast. And I'm sure you have too.
Yeah.
What are your thoughts on why people are struggling more these days?
Well, look, the world has gone crazy. I mean, we've had this horrible pandemic, has just changed everybody's life on the planet. It's made what used to be a major source of support and pleasure, going out in the world, meeting friends, a source of fear, danger, and sometimes death. We've got terrible political polarization. We've got the rise of intolerant, incompetent, corrupt strongmen around the world. I think all of these pressures, the volatility of our politics reflects in part this sort of pervasive stress and interference with social resources to help deal with the stress. And then there are financial problems and it just goes on and on. I'm waiting for the biblical plague of locusts next, but there are lots of reasons why people are edgy and insecure and uncomfortable. I'm worried because the processes of repair are in need of repair, and the things that are stressing us keep proliferating.
And I think of all the things you described there, the characteristic of all of them is that they're outside of our control, right? This is relevant to the research that you've done as well, just that underlying feature of anxiety when we perceive things to be outside of our control.
Yes, that's right, Amanda. And one way that we try to approach it, and we have found helps people, is there are a lot of things we can't control, but what tends to happen is that when you're facing something that you don't control, it makes you anxious. Now, from an evolutionary point of view, as I mentioned earlier, humans are pretty pathetic, right? We've evolved to view all threats as existential physical threats. And that means if you're going to deal with that, you've got to fight or flee. So your heart rate goes up, your blood pressure goes up, you start to sweat, your muscles tense. Then you notice that. So your interoception kicks in and you think, oh my God, this must be really bad. I haven't felt this bad since the last time something bad happened. And so you get more anxious, and then your body says, uh-oh, now he's really getting anxious. So it's like a snowball effect. So where I try to help people in dealing with stress is to find the one thing they actually can control, and that is its effect on your body and therefore on you.
Right.
So what we do is we start teaching people a certain kind of breathing that tends to trigger self-soothing parasympathetic activity instead of sympathetic activity. So the one we found particularly helpful is cyclic sighing. People tend to say, just take a deep breath. But there's actually a problem with that because the way the heart pumps is related in part to the amount and speed of return of blood into the heart so that it can pump out into the arteries. When you inhale, you lower pressure in your chest. You reduce the rate of return of blood into the atrium of the heart. And so the sinoatrial node senses that and says, uh-oh, we better pump faster because we're not getting as much blood. So you increase your heart rate. It triggers sympathetic activity, norepinephrine, epinephrine, and your heart pumps faster. When you exhale, you do that by increasing pressure in your chest. You constrict your lungs. And the sinoatrial node says, oh, there's plenty of blood coming to the heart. We can slow down. That's the parasympathetic system. That's the one that dominates when we sleep.
Okay.
You got to turn off your sympathetic system. That's why alarm clocks work. They trigger a sympathetic response and you wake up. So when you exhale slowly, you actually have the potential to slow your heart. And the change in that is called heart rate variability.
Okay.
And there's a lot of research now that shows that the more variability, the more your heart is speeding and slowing and speeding and slowing, rather than just plunk, 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 the more parasympathetic autonomic activity you have, the less sympathetic activity, and the more relaxed you are, basically.
Mm-hmm. Okay.
And heart rate variability is a very good predictor of survival after a heart attack. It actually predicts survival with cancer as well. So the capacity of your autonomic nervous system to change as events change can help you feel better and can actually soothe your body.
Mm-hmm.
I've been studying hypnosis and publishing research studies about it and doing clinical work for my entire career. And I've been very interested in the change in mental state that can lead to changes in physical states. And Andrew Huberman, who is a neurophysiologist and studies in relation to eye function and alerting and arousal, approached me a couple of years ago and said, we may have some overlapping areas of interest. He had me on his wonderful podcast, the Huberman Lab, and we got to talking more about our overlapping areas of interest. And about that time, a wonderful businessman named Victor Koo and his foundation, Tianren, said, I had an experience with a teacher in India who taught me how to breathe in a certain way. And it made all the difference in my ability to concentrate. And for me, concentration is my life. I have to choose the right projects and investments, not the wrong ones. I need to think clearly and not let anxiety about making the mistake drive what I'm doing. So would you guys be interested in studying it? We took a deep breath and said, sure, why not? And it started a collaboration between Andrew and myself. So what we found in this particular study, in which we recruited people to just do 5 minutes of breath work once a day for a month, we had them either do 5 minutes of meditation. And meditation, you don't try to control your breath, you just observe it. Mm-hmm. Don't fight it, you don't push it, you just let it flow through you. Mm-hmm. So it's open presence is what it's often called, along with developing a sense of compassion for others, which is a good thing, and observing what's going on in your body with a sense of non-judgmental awareness and trying to sort of turn down your self-worth. So we had 5 minutes of that versus one of 3 breathing exercises. One involved box breathing. So you inhale for 3 seconds, hold for 3 seconds, exhale, and hold. And so you just equal in and out. Another one, the inhaling. So you would breathe in very quickly, hold it, and breathe out quickly. The third was the opposite. We called it cyclic sighing. Mm-hmm. Now, we all sigh as humans, and we associate it somewhat with sadness, but it is a form of self-soothing. Mm-hmm. So you inhale about halfway, hold, fill your lungs completely, and then slowly exhale through your mouth. And if you try it now, you see what it feels like. So inhale, hold, fill your lungs, and now slowly exhale through your mouth.
Yeah.
And let's try one more time. Inhale, hold, fill your lungs, and then slowly exhale through your mouth.
Yeah.
How are you feeling right now?
I can feel myself getting calmer. Yes.
Good. See, and it doesn't take long. Isn't that nice that you can?
Mm-hmm. It's a nice feeling.
One of the very cool things about breathing, there are some automatic activities in the body that we don't really directly control very much. Your heart rate, other than by the method I talked about, your digestion, a lot of things. Breathing is right at the edge. Mm-hmm. If you don't think about it, you still breathe, hopefully, but you can easily control it. And so it's I think a pathway into regulating these semi-automatic control systems in the body. And so you just, with 3 cyclic sighs, managed to make yourself feel more comfortable. So the idea is that with breath work, with hypnosis, what I do with hypnosis is I have people imagine they're floating in a bath, a lake, a hot tub, or just floating in space. And as you do that, you affiliate with memories and thoughts that help your body to feel better, feel different. Mm-hmm. The stressor is still going on out there. Mm-hmm. But you can now say, hey, you know what? I know it's happening, but I can make my body more comfortable. And that's a setting in which you're beginning to control something about the stressor.
Right.
In hypnosis, I have people picture on an imaginary screen, on the left side of the screen, one thing that's causing you stress, but keep your body floating and comfortable. And on the right side, picture one thing you can do about it. We all know that just if you have a plan to deal with something, you also begin to feel better. Those are some of the techniques that we can use that we and others have shown actually reduce your response to the stress. And in this study that we just published, we found that people who did this just 5 minutes a day for a month, all of the breathwork conditions, people felt somewhat less anxious and more positive, but particularly cyclic sighing, they felt less anxious and had more positive emotion. They're more upbeat. And on average, they were breathing more slowly, which meant that their resting level of arousal was lower. And that's just 5 minutes a day doing cyclic sighing. So there are simple, straightforward, non-pharmacological things we can do to improve our mood and lower our levels of stress. And that's what we showed in that paper.
Thank you so much for the description of all those things. Those are questions I was going to ask. I was going to ask you if you wouldn't mind taking me through the exercise just, to practice it here today. So I appreciate that you have done that. Also for our listeners, because now they can try it on their own.
Sure.
Right?
Sure.
Because they've heard the instructions. So what's the difference between the breathing we do all the time without thinking and conscious breath work? Like as it relates to anxiety? You kind of touched on it a bit, but.
Well, sort of the opposite kind of breathing that makes people very anxious and is a sign of very anxious is when people are hyperventilating very fast. When we're anxious, we often will do that. We'll sort of prepare ourselves for some kind of struggle. They're inhaling and exhaling so much that they blow off too much carbon dioxide. The carbon dioxide reduction is a trigger for more rapid respiration. And so it becomes a vicious cycle where you have trouble stopping the rapid respiration because you keep blowing off all of your carbon dioxide. And that's why, the old paper bag trick that you have people doing that breathe into a paper bag, it collects their carbon dioxide. So you can elevate the levels. And so that changes the acidity of the blood and that changes the respiratory drive. So breathing seems to be one of those sort of crucial areas related to anxiety. Both anxiety produces abnormalities in breathing, and abnormalities in breathing can make you anxious. It's, again, one of these snowball effects where one leads to the other, and it's hard to interrupt. But in general, if you think about what we sort of do spontaneously, when you do take a big sigh, you're just kind of slowing down and stopping. And sometimes it's associated with sadness. It's not always a happy thing. We think of the word sigh as an expression of sad emotion. And it can be, but it's also a kind of expression of acceptance,
Right. Yeah.
And so we're expressing and experiencing an emotion that's tied to our breathing. And so the thing is, can we do things to take charge of that and use it to manage our emotions? That's the idea. And that's one of the things about breath work. It seems to be helpful. And we're going on to do some more now. We're going to be looking at functional magnetic resonance imaging. So we're doing it and moving ahead to the next step now.
What is the next step going to be? Because it sounded like this was, sort of a preliminary step to sort of test out some of these variables to show a result of some kind. And then where will you take it next?
Well, we're interested in comparing it with other active interventions like hypnosis. And in particular, we would like to take some subjects now that the worst of the pandemic is over, I hope, and we can get people back into an MRI scanner and see what's similar and what's different to what changes we see in the brain with hypnosis, to see if we can better understand what re-regulation of the breath can do to people mentally. And the thing that we have in common is the sort of time frame and ability for people to make changes. That is mindfulness, which has, attracted millions and millions of followers in the West and is a very interesting technique. The whole point, as I understand mindfulness, and you know more about mindfulness than I do, Amanda, is that the goal is not to have a goal.
Right.
It's to kind of let go of your selfhood, let go of your intentionality, and just be and see what happens.
Yeah, I guess with practice, I think people hope with their doing this practice that it's going to have the impact of reducing stress, reducing anxiety, depression, pain. But yeah, I think you're right there that it's really just to be with
Hypnosis is different. It's Western. It is a shift in mental state. It's a shift in attention and concentration. But we don't find people going around saying, I want to be a hypnotizee, the way you see people saying, I'm a meditator. And so we use it for a purpose. And that's something that we thought breathwork is in. You take an ordinary function and use it to solve a problem of one kind or another. So we found with hypnosis that people using it on our Reverie app, a large sample of people were able to reduce their self-reported stress levels by 35% in 15 minutes. So they could just learn this technique of floating, get your body floating uncomfortable, picture a problem out there on an imaginary screen and figure out how to solve it. So those two techniques seem to have something in common and were somewhat different from mindfulness, which is also interesting.
Right.
And we found on functional magnetic resonance imaging that another thing that happens in hypnosis is you disconnect the posterior cingulate cortex. That's the part of the brain that's called the default mode network, where when you're not doing anything much, you're just, reflecting on yourself and your life and who you are. You disconnect in more intensely what you're doing with the executive control network, the frontal cortex, and the posterior cingulate cortex, the default mode. So you're disconnecting what you're doing from who you think you are.
Right. Okay.
So it's like a rapid and brief kind of response that you get more chronically when you do mindfulness. And that's what you should be doing. You're sort of turning off yourself in a sense and just being. And you do that in a more rapid and acute way in hypnosis. And so it's a way of letting go of old problems, old way of thinking of things, and just trying something different and seeing what happens without judging it. So we find that can be a very useful therapeutic tool, and people can try it on Reverie. It's just Reveri. We have a website, and you can download it, the Reverie app.
Oh, great.
And I think that's the future of a lot of mental health care is to find those aspects of it. It isn't everything, but those aspects of it that are disseminable and make it available to as many people as possible.
It's one upside of technology, right?
Yes, we found one. So let's make the most of it. That's right, Amanda.
I mean, I was interested in the result of when you compared the different techniques, so mindfulness with all the different breathing techniques, and you saw that they were all reducing negative affect, but the difference was in the positive affect for the cyclic sighing.
That's right.
I was wondering about that from kind of a nerdy research perspective of why we would see that the meditation didn't improve mood, which it actually makes sense, because if we're just sitting with what is, we might be sitting with something that is not very pleasant, right?
Right.
And so it doesn't, I think this is a misconception people might have often about meditation, is that it's going to make them feel better. And a lot of time it's prescribed by physicians. I think you should go start a meditation practice. And for many people, especially in the beginning, it doesn't actually feel very good. It's actually bringing a lot of attention to negative thoughts or memories or body sensations that people don't like.
Right.
And so I was wondering if this might be why there was that difference there between the two.
Well, yeah, I think it's a very good point, that the idea is you're not supposed to judge them, that it's the experience of feeling bad about something. It doesn't mean the thing is really as bad as you're thinking. And that's like cognitive behavioral therapy too, in that sense. But to be fair to meditation also, you kind of reach that equilibrium over a longer period of time. That is, we just did 5 minutes of meditation. That's too short. For most people would practice for half an hour or something like that. So some of it may also be that you don't get to reach equilibrium. Headspace, which is one of the two leading meditation apps, reports that after 3 weeks, their users are 16% happier. So on balance, it may work out, but it takes some time to get to the point where you reach that level of equanimity about even bad things. And so it may be a bit of an unfair test, but I think you're also right, actually, that meditation is not about problem solving. It's about problem tolerating.
Which is a skill, right?
That's a skill. That's not easy. And sometimes it hurts. That's right. So the techniques are different. They use different parts of the brain, although there's some overlap, and they're done for a different purpose.
Yeah, which I think is why it was a very useful comparison. Like, I was glad that you did include meditation in the trial, because it kind of differentiates what is for what. You really got to think about, as a clinician, when you're prescribing something, what is the goal here? And so I think it really helps to kind of narrow that down. I was wondering too, if you do see that doctors might start prescribing this, like, is that your hope?
Well, I would certainly like that. I'd love that, Amanda. And I think I've been doing this for a long time now. And I used to think, sort of build it and they will come, you build a research base, you prove that it works and all that. Well, I'm tired of that. I've been doing it. I'm still doing it, but I'm not holding my breath, that it's going to change medical practice very much. I wish it would. The best medical schools have a course in hypnosis, but most of them don't. It's hard to find a well-trained licensed medical or dental or psychological professional who does hypnosis anywhere. So we decided to do what in the business world they call D2C, direct to consumer. I've decided that I'm not going to wait to convince my colleagues to do it. I've been doing that all my career. I've published, 150 articles about hypnosis research, a textbook on it. I've done that and it hasn't moved the needle very much. So my new approach is let's go to the people who would use it. And we're not billing it as a treatment. We're billing it as a health skill. Right. That people are using. And the thing that I've been pleased and a little surprised about, to tell you the truth, 30 years ago, I wouldn't have dared to do it. Oh my God, you're hypnotizing all these people out there. What's going to happen to them? Well, I can tell you the number of adverse events among many, many thousands of people using it, I can count on the fingers of both hands, and they're all minor. It may amuse you to know that when the automobile was invented about 100 years ago, a lot of people objected. There were going to be laws passed preventing cars from having windshield wipers. Now, you might say, what's that about? Well, remember the oldest image of somebody inducing hypnosis, it's 250 years old, it's still around. It's the dangling watch, right? So what do your eyes do in a dangling watch?
Oh.
So the idea was that that's what windshield wipers would do, that all these drivers would be hypnotized. Well, it didn't happen.
There was misinformation even back then. That's right. But it didn't get around that fast, fortunately. So I've decided, let's just appeal to people who want to solve problems and let them use it if they want and show them how to use it. And originally when I did it, I wanted to make it something like as good as what happens in my office. But you know what? In some ways, it's better. If you wake up at 3 a.m, even after I've taught you how to use self-hypnosis to go to sleep, I'm not going to be there in your bedroom helping you do it, but I can be on your smartphone. So you'll hear my mellifluous voice telling you to feel your body floating, project your ideas, thoughts, and fears onto an imaginary screen, and think about things that comfort you as well as discomfort you. Eventually, I'd like to do enough randomized trials with the app that the FDA might approve it as a treatment. But I'm taking a shortcut here and going direct to consumer. So I'm just looking at our time. I mean, I could talk to you all day long. You're just a wealth of information and knowledge. However, we do have a time limit. So I thought maybe to our listeners who struggle with anxiety, depression, or another mental health issue, what do you think are your 3 biggest tips that they can do today to help them improve their mood?
Well, I would say one is identify it as an issue. That is, rather than feeling immersed in misery, feeling hopeless, helpless, and worthless, recognize that it's not just a feeling you have, it's a problem, and that there are lots of things can be done about it. And certainly if you're feeling desperately sad or thinking of harming yourself, get help immediately. If not, there is help. Techniques like hypnosis and mindfulness and breath work. There are trained psychologists and psychiatrists for whom this is our day job, helping people with it. There are medications. So the second thing is, find a path to get help one way or another. Acknowledge that it's a problem, find a path to get help. And one of the things on that path might be taking a meditation class or downloading Reverie on your phone and see what it feels like. We tend to blame ourselves inappropriately for mental problems that humans have because we're human. And sometimes the very fact that we feel bad, that we're grieving a death or a loss, that we feel bad about a friend letting us down, is because we're human, because we're social creatures. And it's not something to blame yourself for. It's something to admire that you feel that much, that you have those kind of feelings. But they're addressable, they're treatable. So the final thing is, somebody once said that the difference between an optimist and a pessimist is that an optimist says this is the best of all possible worlds, and a pessimist says you're so right. Don't be the pessimist, be the optimist. There's things you can do about almost anything. So get active about it and you'll start to feel better, and get help with it.
Thank you.
You're welcome.
Thank you so much for all of your knowledge and for the app and for the research. Very interesting. And I'm looking forward to trying it for myself and also bringing it to my clients.
Cool. Well, I hope you can, and I hope you will, and I hope it will help them.
That was Medcan's consulting psychologist, Dr. Amanda Beaman, in conversation with Dr. David Spiegel, medical director of the Center for Integrative Medicine at Stanford University.
If you feel like you'd benefit from talking to a professional about your mental health, contact booking team at medcan.com.
Follow Medcan on Twitter and Instagram at MedcanLiveWell, and follow Medcan CEO Sean Francis at Sean C. Francis, that's Sean with a U.
You can also subscribe to Medcan at YouTube just by searching Medcan in the YouTube search bar.
We'll post episode highlights, the controlled breathwork study, and other helpful links that you can visit on our website, eatmovethinkpodcast.com.
Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com.
Eat Move Think is produced by Ghost Bureau. I am Jasmine Ratch, managing producer.
Social media and strategy support is from Chantal Gertin, Andrew Imax, and Emily Bozick, and I'm executive producer Christopher Scholgen.
We'll be back soon with a new episode examining the latest in health and wellness. This podcast episode is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.